Hi everybody, I'm Naufal. Welcome to my channel. Today we are going to discuss regarding electroconvulsive therapy, that is ECT, electroconvulsive therapy. So what is meant by electroconvulsive therapy? It is nothing, it is the induction of the grand mal seizure. Okay, it is the artificial induction of the grand mal seizure through the application of electrical current into the brain. So artificially we are making an grand mal seizure. Grand mal seizure is a type of seizure. So what is seizure? Seizure is a sudden uncontrolled body movement and changes in the behavior due to the abnormal activities in the electrical activities in the brain, that is seizure. So here we are making an artificial grand mal seizure. Grand mal seizure is a type of seizure through the application of electrical current into the brain, that is electroconvulsive therapy. Electroconvulsive therapy is the artificial induction of grand mal seizure through the application of electrical current into the brain. We are introducing a grand mal seizure. Artificially we are making an grand mal seizure. How? Through the application of electrical current into the brain, that is electroconvulsive therapy. Now we can see the types of electroconvulsive therapy. It is mainly classified into direct ECT and modified ECT. Okay, the type is mainly divided into direct as well as the modified ECT. So in the direct ECT we are not giving anesthesia and muscle relaxants. Directly we are giving the electroconvulsive therapy. We are not using anesthesia and muscle relaxants. Earlier we were using this technique, but now we are not using this type of ECT. Okay, direct ECT means we are not using anesthesia and muscle relaxant. Directly we are giving the ECT. Okay, next classification is modified ECT. That means electroconvulsive therapy is given with the help of anesthesia and muscle relaxants. At present we are using the modified electroconvulsive therapy. Okay, now we can see regarding the parameters of electrical current used in the electroconvulsive therapy. The parameters of electrical current used in the electroconvulsive therapy. So as per the American Psychiatric Association, the voltage of the ECT is 70 to 120 volt. Okay, 70 to 120 volt. The voltage of the ECT is 70 to 120 volt. And the duration is 0.7 second to 1.5 second. Okay, the duration is only 0.7 second to 1.5 second. So in movie you can see that they are using for 5 minutes and all, but in the real ECT the duration is only 0.7 to 1.5 second. Now the total number of ECT. The total number of ECT is 6 to 10 and maybe up to 25. Maximum you can give 25. Normally the total number will be 6 to 10. As well as the frequency of the ECT. The frequency of the ECT is 3 times in a week. 3 times in a week or as the order of the physician. Normally 3 times a week or as per the physician's order is the frequency of the ECT, and the total number will be 6 to 10 and maybe up to 25. Okay, that is the parameter of the ECT and the total number and the frequency of the ECT. Now we can see regarding the mechanism of action, how the ECT is working. The mechanism of action, the exact mechanism of action of electroconvulsive therapy is unknown. Some hypotheses or some predictions are there, but the exact mechanism of action, how it is working, it is unknown. Okay, next we can see the indication of electroconvulsive therapy. First one is major depression. So, major depression is an indication of electroconvulsive therapy. In major depression, if the patient is not taking the food and fluid, the patient is not eating and not drinking, or the drug is not responding properly, or sometimes that drug may be the antidepressant drug may be contraindicated to that patient. That time we can give ECT in major depression. If the patient is not taking the food or the fluid, as well as the drug is not responding or the drug is contraindicated to that patient. That time we can give ECT for the major depression cases. Now next indication is severe catatonia. Severe catatonia. Here also in catatonia, the patient is not taking the food, the patient is not taking the fluid, and the drug is not responding, and the patient is showing stupor. Stupor is there. That means, what is meant by stupor? The stupor means the person is not at all aware about his surroundings and he is not reacting to whatever happening in the surrounding. That is stupor. The patient is not at all aware about the surroundings. That time also we can give the ECT in severe catatonia. Next one is severe psychosis. Severe psychosis include schizophrenia and mania. Okay, schizophrenia and mania. So here there is a chance of suicidal risk. The patient will try to commit the suicide or physical assault. That means he may harm himself as well as he may harm others also. He may attack others also. That time also we can give ECT in severe psychosis, as well as the patient is not taking the food and fluid, as well as the drug is not responding properly and the drug is contraindicated to some patient in the psychosis cases also. That time also we can give ECT. It is also a indication of ECT. Next one is organic mental disorders. So in the organic mental disorder also it is a indication to give ECT. Okay. Last one is other indications. Some other indications are also there for the ECT. For example, for the pregnant woman, the case is depression. Sometimes the antidepressant drug may affect the growth of the child or the life of the child. That time ECT can be given instead of giving antidepressant therapy. And in some cases the drug is contraindicated. For example, for some heart patients, the antidepressant drug is contraindicated or the drug is not responding properly. That time also we can give the electroconvulsive therapy. Okay. Next we can see the contraindications of ECT. Some contraindications of ECT. First one is increased ICP, that is increased intracranial pressure. If the intracranial pressure is high, it is a contraindication of ECT. You can't give electroconvulsive therapy for a patient his intracranial pressure is high. Okay. Next one is cerebral aneurysm. In case of cerebral aneurysm also it is contraindicated. Next one is cerebral hemorrhage. In case of cerebral hemorrhage also it is contraindicated. Next one is brain tumor. Next one is acute myocardial infarction. Next one is congestive heart failure. Next one is pneumonia. Last one is retinal detachment. In these all cases, all these cases, the ECT is contraindicated. That means don't give electroconvulsive therapy to these patients. Okay. Next we can see the complication of ECT. The complication of ECT. So first of all, the life-threatening complication of ECT is very rare. That means death of the patient due to electroconvulsive therapy is very rare. Life-threatening complication is rare in ECT. But in some patient, that is, the patient is having osteoporosis. It is a musculoskeletal system related disease. In such cases, sometimes fracture may occur. In the osteoporosis cases, sometimes due to the ECT, fracture may occur. As well as for some heart patients, there is a chance of respiratory arrest. Okay, that is the complication of electroconvulsive therapy. Next, we can see the side effects of ECT. Side effects of ECT. First one is memory impairment. Memory impairment. Next one is confusion. Next one is drowsiness. Next one is anxiety, dryness of the mouth, vomiting, nausea and incontinence, as well as the tongue bite may occur in the ECT. It is a side effect of ECT. The memory impairment, confusion, restlessness, anxiety, dry mouth, headache, as well as the muscle ache or the total body ache, as well as the nausea, vomiting, incontinence of urine, as well as the tongue bite is a side effect of electroconvulsive therapy. Next, we can see regarding the important part of the ECT, that is role of the nurse in electroconvulsive therapy. So, the role of the nurse in ECT, first one is pre-procedure care. Before the procedure of the ECG, what are the role of the nurse? The pre-procedure care. Pre-procedure care. First of all, the nurse should collect the detailed history of the physical and psychiatric history. A detailed history collection regarding the physical as well as the psychiatric history you have to note, including the history of allergies. Any allergy is there or not, you have to note. Next, you have to assess the knowledge of the patient as well as the family members regarding the complication, side effects, indication and the adverse effect of the ECT. You have to assess the knowledge level of the patient as well as the family members, whether they know regarding ECT, any doubt is there or not, that you have to assess and you have to clarify their doubts. Now, the next step is collect the informed consent. You have to take the informed consent. That means you have to get the permission from the patient or from the family members. Yes, we are willing to do this procedure. We don't have any objection. You have to get the informed consent from the patient or from the family members. Next one, check the vital signs. Check the vital signs. Now, withhold the night medications like diazepam, barbiturates and anticonvulsants. That will increase the seizure threshold. So, at morning you are giving the ECT, at night don't give diazepam as well as barbiturates and anticonvulsant drugs. It will increase the seizure threshold. And withhold all the morning medication. All the medication that is giving at the morning should not be given while you are giving the ECT. Withhold all the morning medications. Okay. Next, head shampooing should be done, because if the oil is there in the hair, it will block the passage of the electricity into the brain. Okay. So, before the electroconvulsive therapy, you have to wash the hair of the patient with shampoo, because oil may block the passage of electricity into the brain. Then the patient should be on empty stomach 4 to 6 hours before ECT. The patient should be on empty stomach 4 to 6 hours before ECT. Now remove all the artificial things like dentures, that is artificial teeth, any metal objects or tight clothing, all the artificial things should be removed from the patient's body before giving the ECT. Now before ECT you have to empty the bowel as well as the bladder. Empty the bowel and bladder before ECT. Okay. At last give atropine 0.6 mg. 0.6 mg atropine should be administered IM or subcutaneous half an hour before electroconvulsive therapy. Half an hour before electroconvulsive therapy you have to give 0.6 mg atropine IM or subcutaneous, or you can give IV. So just before ECT only, not half an hour before. If you are giving IM or subcutaneous, give half an hour, that is 30 minutes before the ECT. If you are giving IV, just before the ECT. So why we are giving atropine means, because after the seizure there is a chance of decrease in the pulse. The pulse may decrease. So atropine will help to solve that problem, as well as atropine will help to reduce the secretions in the respiratory tract. Will help to reduce the secretions within the respiratory tract. So before the ECT, 30 minutes before, you can give IM or subcutaneous, or you can give IV just before the ECT. Okay. Next is the intra procedure care. Next it is intra procedure care. Intra procedure care. So that is in between the procedure. Pre means before the procedure. Here the intra procedure means in between the procedure. What is the role of the nurse? We are discussing the role of the nurse. We discussed regarding the pre procedure care. Now we are discussing regarding intra procedure care. So during the procedure, first of all, you have to place the patient in a supine position in the ECT table. Okay, place the patient in the supine position. Now you have to stand with the patient to reduce the anxiety of the patient. You have to stand with the patient to reduce the anxiety of the patient. Next thing, assist while administering the anesthesia. Assist while administering the anesthesia, that is thiopentol sodium 3 to 5 mg per kg body weight. Okay, thiopentol sodium 3 to 5 mg per kg body weight anesthesia you have to give. So you have to assist while giving the anesthesia, and muscle relaxant, that is succinylcholine. 1 mg per kg body weight. Okay, succinylcholine, that is the muscle relaxant, you have to give 1 mg per kg body weight. So the nurse should assist while giving the anesthesia as well as the muscle relaxants. Now you have to note, since the muscle relaxants will relax all the muscles including the respiratory muscles, so the patent airway should be maintained, that is the clear airway should be maintained, and administer 100% oxygen. Administer 100% oxygen and insert a mouth gag to prevent the tongue bite. Okay, to prevent the tongue bite. Now you have to clean the area where you are placing the electrodes. Where you are placing the electrodes, you have to clean with normal saline, or you can use 25% bicarbonate solution. Okay, 25% bicarbonate solution and apply jelly where you are placing the electrodes. Now you have to monitor the voltage, duration and intensity of the electrical stimulus. Voltage, intensity and duration of the electrical stimulus. During the seizure, you have to check the vital signs ECG and EEG. ECG and EEG you have to check. Electrocardiogram as well as the electroencephalogram you have to check during the seizure. Okay. Now you have to note each and everything regarding the medications given in the patient chart. Record the findings in the patient chart. That is the things coming under the intra procedure care. Now the last one is post procedure care. After giving the ECT, what the nurse should do, that is the post procedure care. Post procedure care. So in the post procedure care, what you have to do, first of all check the vital signs. Next one is continue oxygen until the spontaneous respiration starts. Continue the oxygen until the spontaneous the respiration starts. Till the spontaneous respiration start, you have to give the oxygen. Check for the post-ictal confusion. Check for the post-ictal confusion. Ictal means seizure. So post-ictal means after the seizure, any confusion is there, you have to check. If the post-ictal confusion is there and restlessness is there, you can give IV diazepam. You can give IV diazepam injection and provide the safety measures. Take the safety measures or safety precautions. So always place the patient in side lying position. Place the patient in side lying position because secretions will be there. So there is a chance of getting aspiration of that secretion. So always place the patient in side lying position and suctioning should be done to prevent the aspiration of the secretions, as well as provide side rails. Provide the side rails to the patient. Now at last reorient the patient once he become normal. Okay. After the recovery, reorient the patient. Your procedure is finished. Now you are okay. Nothing to be worried. Reorient the patient. At last you have to note all the things and the medicines as given or important findings in the patient chart. That is the post procedure care. That is the role of the nurse in the post procedure care. One thing we have to note, how to place the electrodes in the ECT. Okay. So next we can see regarding the placement of the electrodes. Placement of the electrodes. How to place the electrodes of the ECT. So mainly two methods are there. That is the bilateral placement as well as bilateral ECT and unilateral ECT. Okay, bilateral ECT as well as unilateral ECT. So here in the bilateral means the both side we will place the electrodes. Both sides we will place the electrodes. That means two electrodes we are using. So where you have to place the electrode, it is the tragus of the ear is there. Okay, this part is the tragus of the ear and the lateral canthus of the eye. Okay, between the tragus of the ear and the lateral canthus of the eye, tragus of the ear and lateral canthus of the eye. Canthus of the eye. So here between these two things, that is the lateral canthus of the eye and tragus of the ear, a midpoint is there. Take the middle part of these two line. Okay, these two things are there, lateral canthus of the eye as well as the tragus of the ear. So the line that is joining these two things, take the middle part of that. Okay, from that middle part you have to take 2.5 to 4 centimeter, 2.5 to 4 centimeter above the line joining the tragus of the ear and the lateral canthus of the eye. 2.5 to 4 centimeter you have to take. We are discussing regarding bilateral. So in the bilateral, both side, from the between the tragus of the ear and canthus of the eye, the midpoint you have to take the middle part, then 2.5 to 4 centimeter above this midpoint. Okay, so here you have to place the one electrode and another one opposite side, the same place, tragus of the ear and lateral canthus of the eye, and 2.5 to 4 centimeter. In bilateral, in the both side you have to place the electrode. But in the unilateral, we are placing the electrode at only one side. Only one side we are placing the electrode. We are placing the electrode in the non-dominant side. In the non-dominant side we are using the, or we are placing the electrode. That is, for a right-handed person, right side of the head we are placing. For the left-handed person, in the left side of the head we are placing the electrode. So two electrodes are there in the unilateral also, but the placement is bit different. One electrode you have to place at the same place only if it is a right-handed person at the right side, left-handed person at the left side. For example, if it is a right-handed person, the same thing, one electrode you have to place between the tragus of the ear and lateral canthus of the eye, take the middle part, then 2.5 to 4 centimeter above that, place one electrode. The second one you have to place at the top of the head. Top of the head you have to place, that is the vertex part of the head. The vertex part of the head you have to place the electrode. Okay, so as compared to the bilateral ECT, unilateral ECT is little bit safer because side effect is very less in unilateral ECT as compared to bilateral ECT. Okay, so before writing the role of the nurse, just add this thing also, placement of the electrodes. Placement of the electrodes. Okay, bilateral and unilateral. Got it? That's all regarding the electroconvulsive therapy. We will meet soon with another video. Till that time, thank you and goodbye.